In this video, we are going to see about contraception mode of action. First, we have to know about the contraception. It's simply about birth control. Use of medicines, devices, surgery for prevent pregnancy. The methods include oral contraceptive pills, injections, vaginal rings, condoms, male and female sterilization. And these methods have different mechanisms of actions and effectiveness in preventing pregnancy. We have to see about the methods: barrier method, hormonal method, long active reversible contraceptive methods or the. In this picture, we are going to see about male condom. It is a stain, collect sperm and prevent it from entering the women's body. Condoms that made of lactose and polyethylene can be prevent STD. STD is nothing but this is the sexually transmitted diseases.
We're gonna see about female condom. This picture represents the female condom, which is also known as internal condom or femidom, which is a barrier device that is used during sexual intercourse as a barrier contraceptive to reduce the probability of pregnancy or a sexually transmitted infection, meant as an alternative to the condom for males in vaginal sex. It is invented by Danish MD Lasse Hessel and designed to be worn internally by the female partner during vaginal sex to prevent exposure to ejaculated cum, semen, or other body fluids. His invention was launched in Europe in 1990 and approved by the FDA for sale. Next, we're going to talk about contraceptive sponge, which is also known as vaginal sponge. This contraceptive sponge combines barrier and spermicidal methods to prevent conception. Sponges work in two ways. First, the sponge is inserted into the vagina so it can cover the cervix and prevent any sperm from entering the uterus. Secondly, the sponge contains spermicide. The sponge is a form of birth control. It's a one-sized disposable piece of polyurethane foam that's put in the vagina to cover the opening of the uterus, which is also known as cervix. The sponge is filled with nonoxynol 9, which is a chemical that kills sperm. Next, we're going to see about combined oral contraceptive pills, which is referred to as the birth control pill or colloquially as the pill, is a type of birth control that is designed to be taken orally by women. The pill contains two important hormones, which is progesterone hormone and estrogen hormone. When taken correctly, it alters the menstrual cycle to eliminate ovulation and prevent pregnancy. An intrauterine device, also known as intrauterine contraceptive device or coil, is a small, often T shaped birth control device that is inserted into the uterus to prevent pregnancy. IUDs are one form of long acting reversible birth control. One study found that female family planning providers choose LARC methods more often than the general public. Among birth control methods, IUDs, along with other contraceptive implants, result in the greatest satisfaction among users. IUDs are safe and effective in adolescents as well as those who have not previously had children. Once an IUD is removed, even after long term use, fertility returns to normal rapidly. Copper devices have a failure rate of about 0.8%, while hormonal devices fail about 0.2% of the time within the first year of use. In comparison, male sterilization and male condoms have a failure rate of about 0.15% and 15% respectively. Copper IUDs can also be used as emergency contraception within 5 days of unprotected sex. All women and girls at risk of an unintended pregnancy have a right to access emergency contraception, and these methods should be routinely included within all national family planning programs. Moreover, emergency contraception should be integrated into healthcare services for populations most at risk of exposure to unprotected sex, including post sexual assault care and services for women and girls living in emergency and humanitarian settings. The following picture represents the hormonal pills which is a one type of emergency contraception, which is also known as emergency contraception pills. It can prevent up to over 95% of pregnancies when taken within 5 days after intercourse. EC can be used in the following situations: unprotected intercourse, concerns about possible contraceptive failure, incorrect use of contraceptives, and sexual assault if without contraception coverage. The emergency contraceptive pill regimens recommended by WHO are ulipristal acetate, levonorgestrel, or combined oral contraceptives consisting of ethinyl estradiol plus levonorgestrel. Disadvantages of contraception: condoms may not be as effective as other birth control methods. Contraceptive pills must be taken daily and do not offer protection against STDs. Pain is experienced when inserting and removing IUDs, and it may slip out of place. Male and female sterilization requires surgery, which is costly and cannot be reversed. Contraception method like oral contraceptives, for example, not only prevent pregnancy but they also reduce the risk of endometrial and ovarian cancer and protect against acute pelvic inflammatory disease and ectopic pregnancies. From this video, I want to create an awareness that the use of contraceptives is very important as it has several benefits to both males and females and also to the economy of the family and country. However, women should be sure to visit their doctors or physicians before making use of any of the modern contraceptive methods. This will help them seek proper advice on which method is best suited for their bodies. This will help reduce the side effects they are prone to.